using every dose. We don't want to see any dose wastes, and that's wasted, and that's why we created more flexibility. If there's a dose that's sitting there and there's no one queued up that's in line based upon the existing tiers, we want to be able to move to other priority groups, other priority phases, and tiers within those phases. And so we want to make sure none of these expired, none of these doses go unused. I'll remind you that the current focus of the vaccinations is healthcare workers, those frontline essential workers. That's why we want to vaccinate the vaccinators. So many of them are in those categories of vaccinators themselves, and then those residents that are most vulnerable in these congregate facilities. We partnered not only with those you've seen up on screen as it relates to those previous slides, but CVS and Walgreens that are doing the lion's share, not in every county. LA County is a big exception, but notably and substantively in all of those other congregate care facilities, Walgreens and CVS are administering as a partner with the state and the federal government to administer the needs within those facilities. The flexibility into the different phases includes the following. And so again, this is already established. We've created these phases and these tiers within the phases, but we want folks to know that we now have flexibility where we can move into these phases and these tiers, which include people 75 and over, includes people 65 and over, if those folks are not present and available. So there's no waste, more flexibility, more capacity. So people in the education system can expect to start getting vaccinated, childcare, so it's teachers and paraprofessionals across the board, those essential workers and all the support staff, all those key members of our support staff, not just teachers that are essential as well to making sure we safely are taking care of the needs of our children. For what it's worth, we talked last week about phase 1C. This is that extended phase where many of you, including myself, this is the phase that we would be in, you might be in, and this phase is now established. It's up on our COVID19.ca.gov website, COVID19.ca.gov website. I'll just remind you that site to learn about all of these things about the availability and updates in terms of the availability of doses and the percentage doses that have been administered and what our time to goal is and the 1 million+ new doses and where you may be within these phases. And we will fill out details as we start to get more doses in. Again, just a little over 2.5 million doses. And that's just doses. We obviously are going to need substantially more doses to get into this next phase, and we hope to learn more with the new administration soon. It's their intent to release a lot of the stockpile of doses, and we'll start to see a greater clarity and then meet your expectation to start to put some timelines, or at least expected timelines, so that we can deal with the anxiety that I know is palpable out there about when we have that availability, when, well, we see it. As it relates to vaccinations as well, we recognize that the current strategy is not going to get us to where we need to go as quickly as we all need to go. And so that's why we're speeding up the administration, not just for priority groups, but also now opening up large sites to do so, meaning Dodger Stadium, Padres Stadium, Cal Expo, these large mass vaccination sites. You start to see those coming up as early as this week. You'll see many, many more, but these are just 3 sites that will be coming up this week. So this is encouraging, and this is, again, part of that flywheel. I know it can't go fast enough that all of us should anticipate and expect as it relates to increasing that last mile for administration. Get it out of the freezer into people's arms, these vaccines.